20 years ago, my family, including my 5-year-old brother, got E. coli in the Jack in the Box outbreak. As I watched my 5-year-old brother writhe in pain caused by E. coli, and I got a secondary case, my mom did too. Meanwhile, over 700 people across the United States were infected, 178 with permanent injuries from E. coli. Several died, including children. This was me at the time. My family lived. But it left me permanently impacted and thinking, we can do better. We can prevent foodborne illness. And so as a kid, I spent every report opportunity researching factory farming, slaughterhouses, regulation on meat processing, and foodborne illness. And what I found was startling. But today, when I got, well, not today, but this year, when I got E. coli again for the second time in my life through a restaurant, it inspired me to go back to research, even though no report was due. And I found that in the United States today, the CDC says that 15% of us will get foodborne illness each year. In a room like that, like this, that's 90 of you, sucks to be you, who are gonna get foodborne illness this year. 60 of you, according to Washington State, will get food poisoning from a restaurant. Now, in between bouts of E. coli, I'm actually an open government expert. I've advised governments around the world. That's me with the Afghan delegation at a United Nations meeting. I ran conferences, an open government nonprofit, and I even helped the city of Seattle I put together a usability study for them on seattle.gov. If you saw the redesign, we helped put that in, and it became #1 or the best municipal website in America as a result. Now, as I researched foodborne illness in King County, I found that King County's own website hadn't been redesigned since 2002, and the way that they presented the data on very valuable data on restaurant inspections in our county was actually very difficult to interpret. A multi-level scoring system that when I tested it on friends and family, they didn't know how to properly interpret the scores. Meanwhile, in counties like LA and municipalities like New York, they had implemented an ABC scoring system. Now, this is an analog version of that data. They posted, it's mandatory at restaurants, and these types of signs bring down foodborne illness hospitalizations by on average 14%, sometimes up to 19%. And because most people never report their foodborne illness, this means a much more significant portion of the population never got sick. Now, Yelp this year approached multiple municipalities like King County and said, hey, we'd like to put a standardized restaurant inspection score on Yelp. Now, whether we love or hate Yelp, sites like it are where we're going for restaurant information. Would have been handy because that's where I found the top rated by consumers restaurant I got sick from that had 5 out of 6 of its last inspections as unsatisfactory in King County. But when I went to King County and I said, hey, let's improve our scoring, let's make it easier to use, let's drive down rates, I was met with risk management lawyers, which was kind of surprising for a person like me. And I wanted to help. I volunteered 30 of my hours, but I never really, besides one meeting, heard back. And I kind of chased him for 3 months saying, let's prevent people from getting sick, and nothing. So I started a change.org petition. And I got over 1,500 signatures and lots of media attention. I was on the network news, pretty solid. This finally caught their attention. And I'm proud to say that King County right now is reviewing its current restaurant rating system and is considering launching a new ratings process soon. And what I'm advocating to King County is that we simplify our rating system. Keep the complex measurements that you need to do your work as public health, but let's have simple grading that helps us represent and quickly interpret, whether we're online or off, what's safe and what's not. And I'm also recommending to them to bring usability testing into the design process for creating a new set of standardized restaurant scoring. We can A/B test as we do in marketing and in websites. There are a lot of tools that we could use. What if we had a few kind of fake food trucks set up with the same score on each, but a different format for the score, and tested how people are spending their money and how safe they felt? I think that we can design processes that make us all safe. And you can sign the petition still. We need to keep pressure on King County to make this happen. I think if we make it possible here, we can make it possible across the United States. Thank you so much, and eat safe.